Hello, lovely friend. I am Dr. Mary Barson.
And I'm Dr. Lucy Burns.
We are doctors,
weight management and metabolic health experts. We are the creators of My Metabolic Action Plan,
your two-step map to real health and weight loss,
which is in fact the name of this podcast.
Join my map now at rlmedicine.com.
Good morning, gorgeous friends. Dr. Lucy here on a wet, wintry Tuesday morning with my beautiful colleague, Dr. Mary. Dr. Mary, how are you this morning, my lovely friend?
Very good. Warm and cozy inside my little cottage, which is nice, and excited to be here with you, beautiful Lucy. Today we are shining a purple light on a topic that I think is still misunderstood, still massively under-recognised, a condition that mostly affects women, a condition that has not been well researched and does not have a lot of research supporting our treatments, and that condition is lypoedema.
Absolutely. And, you know, some people may pronounce it lipedema. Both are acceptable. But what it isn't is lymphoedema, and it's not lipidemia. It is lypoedema or lipedema. In Australia, it's spelled with an O. In America, it doesn't have an O in it. They're the same condition. And interestingly, I first learnt about this about 10 years ago now from a patient because I had never heard it. And when she first mentioned it, I'm going, do you mean lymphoedema? She looked at me like horrified. Lucy, it's lypoedema or lipedema. Lipedema. Go lipedema. And the reason we want to talk about it and the reason you're banging on about the purple light is it is. June is Lypoedema Awareness Month. Purple is the colour, and there are lots of buildings being lit up around Australia in purple. I think last year they had the Opera House, but this year it's lots of town halls. So kudos to the Australian Lypoedema Society for raising awareness for this condition.
Yes, because we do need more awareness. It is, I think, startlingly common and under-recognised. And it doesn't only affect women, but it mostly affects women. So if you've ever felt like, you know, your arms or legs, just the body fat on your arms, your legs, it just doesn't respond to diet and exercise the way that perhaps other parts of your body do, it might be that you have this condition called lypoedema. And typically women with lypoedema are often just told to lose weight, and that advice is incomplete to the point of being actually unhelpful. So let's talk about what lypoedema actually is, what we know about the causes and the underlying biology, and we still don't completely know everything, and why it often gets missed, and how you can support your body with lifestyle, what the treatments are that are available, and what we can do to actually support women who suffer from this, what can be quite a debilitating condition.
Oh, absolutely. And the thing to know, right, is that it's actually probably about 12% of women. Like, that's an enormous. We don't have many other medical conditions that affect 12% of a population, the female population in this case. Even diabetes, which is considered, you know, an epidemic, that runs at about 5%. So it is really, really prevalent, really common, and as you mentioned at the start, misunderstood, misdiagnosed, or underdiagnosed.
So let's start with the basics. Lypoedema is this chronic condition where there's an abnormal buildup of fat and connective tissue around usually the hips, thighs, buttocks, lower legs, can also affect the arms, though not as often. And it tends to be symmetrical. So it affects both legs, both arms equally. And it almost always affects women.
Yes. And it's not just being overweight. So people at any size can have lypoedema. You can be in what might be considered the normal weight range and still have lypoedema in your arms and legs.
Yes. And what makes a difference is it isn't just normal fat tissue or normal adipose tissue. It is fat tissue that is often painful and tender. It often bruises easily. It can feel quite heavy. It can feel quite tight. It spares the feet nearly always. And it has this sort of classic distribution that we can see that's quite sort of typical of lipedema. And we think of it as a disorder of fat distribution and the tissue quality. So it's not simply having, too much fuel in and not enough fuel out. You need to burn more calories than you're eating. It's actually the fat cells and the surrounding tissue make the fat that accumulates in lipedema very biologically different, makes it difficult to lose sort of with traditional weight loss measures. And it also makes it painful, inflamed, and can significantly actually impair quality of life.
Yes, absolutely. Interestingly, it's not metabolically active, though, in the way that we would normally look at, say, visceral fat tissue. So I've seen plenty of women who, what people might think are overweight, they've got a high BMI. And when you do all of their bloods, their insulin's normal, your leptin's normal, everything else is normal. But it's a separate condition. Having said that, some women can have both and have traditional obesity with lipedema. And we know that the tricky bit is that women with lipedema have often spent years dieting. So the prevalence of eating disorders is much higher. The prevalence of body dissatisfaction, obviously much higher. They've often tried every diet, every boot camp, even, had bariatric surgery for maybe the underlying obesity, but their leg shape can still be the same. It's not about being, lazy, non-compliant or any of that rubbish that they may have been told. And it's often just that we're dealing with two separate conditions.
Mm-hmm. And there's a lot that we don't understand about what causes lipedema. We have a much better understanding of the multiple causes behind obesity and metabolic ill health, but lipedema is a little bit less understood. But we do have some pretty strong clues. There is stuff that we do know, so perhaps we should talk about what we do know about the causes of lipedema.
Yeah, absolutely. And I think the thing to know is that for people wanting to understand about how fat tissue works, fat tissue is made up of sort of two components. We've got the fat cells, which are called adipocytes, and then we've got the connective tissue or the extracellular tissue that holds it all. And so we know that lipedema is a condition that affects both of those, and we can break it down sort of into three pillars, if you like. So Mez, maybe you could go through those.
Yeah, absolutely. So the first one is genetics. That plays a strong part. We know that lipedema often runs in families. Mothers, daughters, sisters can often have it. And your genetics aren't your destiny, but they do play a strong role in having that predisposition. So a tendency to have fat tissue and blood vessels that behave in a particular way. There's no single gene that has been pinned down, so it's likely going to be, polygenetic is the word, and lots of interacting genes. It's likely going to be quite complex, but heritability does play a role. So people have a genetic predisposition. And then secondly, there's hormones. So lipedema commonly appears worse around the big hormonal transitions. So puberty, pregnancy, perimenopause, menopause. And because we observe this in the women who have lipedema, this tells us that the sex hormones, likely estrogen, must play a strong role. And so there's some role that estrogen plays interacting. It wouldn't be estrogen would be the only hormone, but the sex hormones play some sort of role interacting with our genetic predisposition, the genetically primed fat tissue. The estrogen then sort of like turns on something. And so we get this estrogen signaling that creates like more fat deposits in this area, and then this sort of disproportionate growth of fat cells and the related connective tissue in those areas. And then there seems to be some sort of local tissue factors. So when the tissue from lipedema is looked at under a microscope, we do see the enlarged fat cells, we see more fat cells, but we also see lots more of the connective tissue, and it's inflamed connective tissue. We see more blood vessels. We see more blood vessels that are more fragile and likely to leak and likely to bruise, which then creates even more inflammation and even more scarring and increased fibrosis and fibrotic tissue. There's more lymphatic system involvement as well. And the lymphatic system is an important part of our immune system. And later on, as lipedema develops, we get increased fluid accumulation and increased lymphatic dysfunction in that area. So it's not just fat, it's a whole microenvironment: blood vessels, lymphatics, connective tissue, immune cells, inflammation, all behaving differently than fat in other parts of the body.
Absolutely. So something that I think is really important for people to understand is that there is probably, we know it's some sort of connective tissue in here. There is probably some issue with the collagen. We don't have the exact details yet, but we do know that the little vessels, tiny vessels called capillaries within this adipose tissue become leaky. So they leak into the tissue, causing swelling, and that starts up this, I guess, cascade of events, and ultimately can lead to fibrosis, which is why women often feel their legs are lumpy. And these lumps can start out either as like little grains of sand, or even a bit more like rice, or then peas, or then even really knobbly, hard, fibrotic sort of little stones in their legs. And so one of the treatments, which, we can get onto a bit later with all the treatment options, but the idea is that if we can stop that accumulated fluid just sitting there, so squeezing it back into the vascular system, then we can hopefully prevent some of the fibrosis and some of the pain. So it's really important to recognize that this is not just the fat cells, not just the adipocytes that are affected, but a large proportion of this is the fluid that accumulates around the cells.
I like that you've really sort of brought that back to real life, to what women are actually experiencing. And we alluded to this before, that many women with lipedema have spent years being told that they're overweight, and perhaps also being told that they're non-compliant or lazy, or even just themselves feeling that they are failures because traditional weight loss measures have not been helpful at reducing that lipedema fat. And they, especially if they're given generic advice, it's not helpful. And when that's done over and over again, that can create this chronic invalidation, which is traumatizing for people.
Yeah, absolutely. And, we all know that for many years, the diet and exercise, the mantra of somehow that makes you thin, lean, everyone's going to look the same is, we now know is just complete bollocks, that people do need to understand there are different body types, different conditions that affect the way our fat is distributed, number one, but then the type of fat that we have on our bodies is so important to understand. Now, some women might be feeling a bit hopeless about all of this, thinking, right, well, then what can I do? And so I think it's important for us to recognize there's lots of things that we can do. Women with lipedema, unlikely to ever look like a gazelle, but women without lipedema, many women without lipedema are unlikely to look like a gazelle. Like, I don't think I'm ever going to fall into the gazelle category. Probably not you either, Mess.
No gazelles here. Yeah.
So, and this is a societal thing, and it's very, very complex at this current stage in the world, with the trend back to thin and skinny talk everywhere. That's skinny stuff on TikTok for any of those who are wondering. So it's about then going, okay, well, these are my genetics. These are the cards I've been dealt. What can I do to play them the best that I can? And that, I think, is if we can use that lens to look at the way we manage our health, our bodies, then that is empowering rather than feeling disempowered.
Yes. And there are things that we really can do. And we love to talk about lifestyle. That's our favorite thing to talk about. And it can be so helpful and powerful. It doesn't magically erase lipedema, but there are powerful lifestyle measures that you can take. And one part of the sort of precipitating factors with lipedema is inflammation. And there are lots that we can do to reduce our overall inflammation. And food is a great place to start. Nourish your beautiful, wonderful body with like real food that's naturally lower in carbohydrates. Make sure you get that protein into you. And this way of eating can just reduce overall inflammation, which will benefit every aspect of your health, as well as inflammation that could be present and driving many of your lipedema symptoms. It also improves insulin sensitivity and metabolic health, and can help with your metabolic health and weight in other areas, even though it may not magically shrink that lipedema fat. Similarly, good sleep and nervous system regulation. So that stress regulation also are going to help, and they're going to help reduce inflammation, which is going to be helpful. They're also going to help reduce pain sensitivity, which is going to be helpful, and generally just improve your resilience to cope in every aspect of your life, including your ability to cope with the challenges of being a woman with lipedema. Movement also is really good too. It helps improve your function, your mobility, and helps keep you, also reduces inflammation, also reduces stress, keeps you strong. And in particular, swimming has got good evidence, as does walking, cycling, and resistance training. Just pick something that you like and move your body regularly, and it'll help.
Absolutely. This is sounding remarkably like the 6 S's.
It is.
So
That's right.
The 6 S's that we talk a lot about for metabolic health are so applicable. They're basically, it's a little formula for anti-inflammatory living. So, the first S being sustenance, your food, the second S being sleep, the third S being the stress management, the fourth S being strength and movement. And then the fifth and sixth S are social connection and some sunlight. The reason that swimming is really helpful for women with lipedema is that it is a type of compression. And manual compression or manual lymphatic drainage, which is called MLD, doesn't fit into the 6 S's framework, but is something that is really helpful for women with lipedema. And it makes sense because we talked about these leaky vessels. We wanting to push that fluid back in. We do that with either compression garments. Women can do it with specialized compression pumps that they can use. And manual lymphatic drainage is really a specific technique done by qualified professionals. I've got no idea how to do it, so I'm clearly not in that category. But they help just move that lymphatic tissue around. So, I think that the whole process is really, it can feel overwhelming, like you've got to do so many things. But if we pare it back to the basics, it's actually women with lipedema do the same thing as women everywhere. The 6 S's, everyone should be doing that. Everyone can do those. They don't have to be perfect. They don't have to be intense. You don't have to, lift 50 times a day. You just need to do some of the basics frequently.
Yes. Small little movements can change the dial quite quickly. This is why I love working in this area. We don't need to, join boot camps and exercise 5 hours a day to see benefits. Small bits, when done consistently, can change your life, which is just a beautiful, beautiful thing to see.
Absolutely. The 6 S's sprinkled in this case with a big bow of self-compassion. Maybe that should be a 7th S, because our bodies are all different. Some women have lipedema, some women have disabilities, some women have polycystic ovarian syndrome or polyendocrine metabolic ovarian syndrome, PMOS. Not many of us are supermodels. We don't need to be worthy, to be valuable, to be, enjoying our life. And I know for lots of women, with lipedema, the shame that has come with the way their legs look has kept them on the sidelines. And, I would just say to any of you, if you can, just get out there. No one gives a shit what your legs look like. I know that sounds try it, but they honestly don't. They're so busy considering what they're, so busy. Most people are so busy thinking about what they look like. They don't even look at other people. So don't let that stop you. Just get out there and do it.
Yeah. I don't have lipedema, but I do not have a gazelle type figure either. And I was recently at Hamilton Island for a GP conference, which was really cool. And I took an afternoon off and went to Whitehaven Beach with my kids. And I was just spent the whole day with lots of sunscreen on, spent the whole afternoon just walking around the beach, swimming in my bathers. And I just felt so wonderful that I could do that. I was, first of all, just having a great time at this beautiful beach, considered one of the most beautiful beaches in the world. And also, I was just modeling this kind of loving my body for what it can do for my daughter, who was also there hanging around in her bathers, and my son in his bathers with lots of sunscreen on, and just felt really good that I could do that. And also seeing everyone else in their bathers too, with all these different body types. And it's just a really beautiful moment for me to reflect that we've just got to love ourselves, our bodies, for the vehicle that they are, and they don't need to be some ornament. Want them to be healthy, functional as much as they can be, and within the limits of the cards we've been dealt, but also put your togs on, get out there and have fun.
Absolutely. Absolutely. I love that. And that's the best type of model, isn't it?
Yes, that's right. Yeah.
So yes, we are. We're all models. We can all model behavior. We can all model the way we want to, we would love the world to be. And I reckon just get out there, my friends, get out there. Good. All right. That's it for us this week. We'll be back next week with another episode, and we'll see you all then. Have a wonderful day.
Bye-bye, beautiful people.
The information shared on the Real Health and Weight Loss podcast, including show notes and links, provides general information only. It is not a substitute, nor is it intended to provide individualised medical advice, diagnosis, or treatment, nor can it be construed as such. Please consult your doctor for any medical concerns.